Say you're 50 years old and you want the best skin of your life. How do we provide that? Well, we've talked about the important concepts: health, overall exercise, staying well hydrated, and avoiding sun and smoking. We know that sunscreen is really key because it really helps to protect your skin from further damage. We also know that topical vitamin A-based analogs can improve skin cell turnover, like tretinoin or Retin-A. And we know that oral collagen supplementation improves skin quality. But in your 50s is when you really want to start investing in interventions, okay? So what do I mean by that? Lasers and microneedling. So basically any kind of treatment on the outside that stimulates skin cell turnover and triggers a healing response, which brings new blood supply, new growth factors to the skin. Lasers help ablate the outer surface. They deal with dark spots, fine lines, wrinkles. Broadband light, other light-based treatments can get rid of the signs of aging and can stimulate the quality of the skin to improve. And then microneedling goes deeper into the dermis. It can thicken the dermis, it can trigger collagen turnover and collagen remodeling, and that can be something that can help prevent aging over time and improve the quality of what's there. We can also deal with volume. I prefer using fat grafting at this stage of people's lives because it's a little more reliable, long-lasting, either nano-fat or structural fat. Of course, fillers are always an option for areas where you want to have rejuvenation with hyaluronic acid and a water-based effect, but it can look a little swollen, so you have to be careful. Our 50s are when we really need to invest, like I said, in those deeper procedures, because the better we do at treating these signs, the longer you're going to look good, and it will help to stave off other types of events. But I think most people nowadays are looking at facial rejuvenation, facelift surgery, or some kind of facial rejuvenation procedure in their mid to late 50s. Waiting to your 60s or beyond is probably not as great because at that time point your skin is not a good quality. Everyone has a rubber band drawer at home with rubber bands from 5 years ago and those from 5 days ago. When you stretch out rubber bands from 5 years ago, they just keep stretching. The ones from 5 days ago, they snap right back. So if you're in your 50s, your skin is still a little snappy, but when you're in your 60s, because of huge hormonal changes, you lose the stretchiness, and the efficacy of a facelift or surgical procedure is not as good because the underlying tissues are not as resilient. So those are the concepts for how we improve our skin in our 50s. That's how you get the best skin of your life in your 50s.